Hello, hi, I'm Dr. M.S. Jayasekhar. I work as a consultant plastic and cosmetic surgeon in Suvarna Aesthetic Plastic Surgery Center, Trivandrum. So, as you all know, the month of October is considered as the Breast Cancer Awareness Month. So, I'm going to discuss in detail a lot of medical information regarding this health hazard. Breast cancer, as you know, has become a scourge of the society, and a lot of young women are now being afflicted with this health issue. So nothing but screening and awareness can prevent and control this health problem to a very great extent. So this month of October and also October 18th is considered as the Breast Cancer Awareness Day. So most of us medical personnel are involved in public education activities, and you also know that people wear pink ribbons during this month. The pink ribbon has become synonymous with breast cancer awareness program. So everyone around the world now knows that wearing of these pink ribbons mean fighting against this disease, against the breast cancer problem in the world. So I will mention a few of the things about breast cancer that affects our society and especially the younger generation. Breast cancer is 100% treatable and curable disease, so there is no need for anyone to panic about it. Only thing is you need effective screening methods so that you can pick up the disease quite early. So once you pick up the disease early, then we can treat it very effectively. There are various screening measures for this, and any woman after the age of 40, we request them to undergo a yearly mammogram examination. Mammogram is a special X-ray of the breast, which will show any growths or any cancer that happens inside the breast. So any woman over the age of 40 should definitely have a mammogram at least once a year. Another effective screening tool is MRI scan, which is more specific and which is a better screening tool than mammogram. And these days we also have blood screening test for detecting breast cancers, and the most latest one is thyroidexin 2. That's a tumor marker which can be found in breast quite earlier during the earlier phase of the disease. And so these are the effective screening tools. So once you screen the community, you can pick up a lot of early breast cancers and you can treat them very effectively and very early. And even we ask all of our ladies, all women in our society to do a self-examination of their breast at least once in 2 weeks. They should routinely examine their breast in front of the mirror, and they should look for any lumps or bumps in the breast, any irregularities of the skin, any discharge from the nipple, or any swellings in the armpit. This all could be warning signs. This could be early signs of breast cancer. So we advise our women folk to do this self-examination on their own. So once the disease is diagnosed, we can treat them very effectively, and in the early stages we can do minimally invasive surgeries that doesn't spoil the aesthetic beauty of the breast. But in late stages, sometimes we may have to do operations that will remove the entire breast. Even if the entire breast is removed, do not worry. We can definitely restore the shape of the breast back to normal using a lot of plastic surgery reconstructive techniques. We have a lot of gadgets and to help us to recreate the gone breast to its original glory. So there is no need to worry. So we can always reconstruct a much more beautiful looking breast after these sort of breast surgeries. And let me conclude this particular issue on all the other problems that affects the female breast. In some women, they have overgrowth of their breast. This is known as breast hypertrophy, and they do suffer a lot because of the heavy breast. We do breast reduction surgeries which will restore the size of the breast back to normal. And similarly, with aging, if the breasts sag and they produce shoulder pain and things like that, we have breast lift surgeries which can restore the glory of the breast. And even for the ladies with small sized underdeveloped breast, we have surgeries called breast augmentation surgeries which can actually build up the breast and make it look good and of normal size. So anything and everything to do with breast. Any health issues are no longer perceived as any permanent problems. We have effective solutions for that. I hope my talk has been informative for my dear audience. Thank you for listening to me once again.